All right, welcome back to People, Pets, and Prosperity. Today's conversation is one that honestly should have happened a long time ago. You see, French Bulldogs have officially become one of the most desired dog breeds in the country. And that didn't happen by accident. You see, culture influenced it, social media amplified it, and celebrity visibility accelerated it. And when millions of people are exposed to a lifestyle without fully understanding the medical reality behind it, eventually medicine has to play catch up. Now, let me be clear from the start. This conversation is not about blaming anyone. This is about cause and effect. This is about awareness. And this is about understanding the difference between what looks cute online and what these dogs may actually be experiencing physiologically every single day. We've seen major public figures like Megan Thee Stallion showcase French Bulldogs to massive audiences, and whether intentional or not, influence matters. Because when influence drives demand faster than education can keep up, we create what many veterinarians are now seeing as normalized dysfunction. Dogs struggling to breathe, being labeled as just the breed, exercise intolerance becoming accepted, snoring, overheating, airway compromise, chronic stress on the body, all becoming normalized behaviors instead of recognized medical concerns. And that's exactly why today's conversation matters. Today, I'm joined by Dr. Boaz Man. Dr. Mann has become well known for his work with brachycephalic breeds and his focus on helping improve airway health and quality of life in these dogs through progressive and less invasive approaches to care. He's seeing these cases firsthand, at scale, and helping push the conversation forward on what responsible ownership and earlier intervention should actually look like. And honestly, this conversation is less an interview and more of a real discussion between colleagues. We're going to talk about how we got here, where communication may be failing short, what pet parents need to understand before committing to these breeds, and what both veterinarians and owners can do moving forward to raise the standard of care. Because at the end of the day, these dogs don't choose this life. We chose it for them. So influence to help create the demand, then education and responsibility have to become the solution. So let's get into it. Dr. Boaz Man, I appreciate you coming.
I appreciate being here.
Yeah, man, tell people about yourself.
So again, it's a pleasure to be here. My name is Dr. Boaz Man. I'm a single doctor, solo vet in Boca Raton, Florida at Boca Midtown Animal Hospital. I'm here to teach any veterinarian here that watches this that you can teach an old dog new tricks, okay?
No pun intended.
Yes, I've been a veterinarian for 22 years, and I haven't been doing this since I started my career. Over the last 5 years, I've helped to develop an improvement in the minimally invasive procedure that we use with the carbon dioxide laser. And I'm talking about BOAS surgery to help reduce their strain and their animal welfare issue known as BOAS, Brachycephalic Obstructive Airway Syndrome. And that just basically means they can't breathe, and we need to remove some parts to help them breathe and get some air from their nose, through their throat, and into their lungs.
Sounds like breathing is kind of important, huh?
Have you ever had something stuck in your throat and it's like the worst feeling, like you feel like you might just die? That's what they have to live with on a daily basis, that flap in their throat that's blocking their airway. It's just stuck there permanently.
Stressed. I can only imagine. I get stressed when I snorkel. That little airway, just trying to breathe. Or
Right.
You have to really focus on like, hey, it's the airway. It's not going to clog. It's not going to collapse. You're okay. I can only imagine what these guys are dealing with on a daily basis.
That's correct. You mentioned the airway. You know, we often hear they're breathing through like a pencil or a straw because it is so thin, because that flap is basically flipping and flopping. And they got this little part that's called the epiglottis that has to open for that air to get through. And it sits there and it traps it and it smacks it and it gets swollen because they get saliva back there, they get food back there. And these dogs have just too much stuff in too small of a space. And I'm talking about the nose and the throat. And if you can help open that up, it's a game changer. And there's not many things like this in my career that I've been able to be part of. So that's why it's been such a passion for me to help meet with people like you and other veterinarians across the country to help them understand and to educate those pet parents on how we can recognize it early and how we can make a big difference in their quality of life.
Perfect. So this sounds like this is going to be essential for not just the pet parents, but veterinarians as well. So let's get into it, Doc. Let's start with at the top. Now, Frenchies don't become number one without a cultural push. I believe the Golden Retriever and the Labrador Retriever for number one for such a long time, for about 5 years before now, right? And then from your perspective, What do you think drove this surge to Frenchies only now?
Well, when you have a child, a newborn child in a stroller, and you have a mom or a grandma walk by that child,
Yeah.
what do you see? You're going to see that big round face, those big eyes, that big forehead, and you're going to be like, oh
Cute.
my gosh, that is so cute. You don't go up to that baby and say, can I pet your baby?
Right,
Right.
right.
But this is something you can actually pet. It's a little puppy. And it's like that human animal bond. That's what drives us as veterinarians, just to help those pets. And at the end of the day, as you know, we were speaking about that oath we took as veterinarians to never let a pet suffer. And here we have America's most popular breeds. We got Frenchies, Pugs, we got English Bulldogs. Most of them are high at risk for these problems. We got the French Bulldog at 17 times higher risk than any other dog breed, followed by the English Bulldog, 12 times higher. Then we go to that Pug, and that's 10 times higher. And guess what? This is based on a study by Nationwide that studied 50,000 of these brachycephalic dogs. But guess what? Those were only the ones that were enrolled that had claims for BOAS. And you and I know very well that there's a lot of uninsured pets in this country and across the world that study did not cover. So we're talking about a lot of problems and a lot of short-nosed dogs.
I love that. I mean, I hate it for them, but I love the education and the understanding because, men lie, women lie, numbers don't lie. And we don't even have the thick of it, of what's really under the radar here. So excellent perspective. Also, not blaming her, but Megan the Stallion did have a lot of influence with showcasing her beautiful Frenchies, which we appreciate. But I don't think the audience that she's attracting fully understand what happens when visibility outpaces education. What are your thoughts on that?
That's entirely true. And these influencers, as you know, have a lot of power. And unfortunately, what happens is they're worried about their followers and about what things are involved in their influence. And they're not worried so much about what's happening to that animal as the years progress,
Right.
as they get worse. And so that popularity contest is always going to be there. And they're always going to want to showcase something. And unfortunately, I don't see many celebrities, influencers speaking about these problems with their pets. Not enough of them, at least. It's starting to change, but we have a big responsibility because at the end of the day, you and I were talking about it. If these celebrities and these influencers aren't going to be helping, it's not going to be the breeders, it's not going to be the pet parents that understand how to fix the problem. It's our job as veterinarians to make sure those animals are healthy and make sure those pet parents know what they're getting themselves into.
Excellent point. And you're right. I think the thing that resonated the most with that conversation is, they will showcase the Frenchie. I got a dapple. Okay, so how you one up me? I got a fluffy. All right, none of them can breathe, and none of them will showcase. I fixed my pet like this. Well, I fixed my pet. Well, at least we fixed it because that's the part that really resonates. Because again, they can't breathe. Imagine just putting a trash bag over your face, and I'm in charge of opening the airway when I want to let you breathe, right? And that's not even like. That's the polite way of doing it because we don't even have that advantage being the human. It's up to them, which really isn't up to them. It's anatomy, right? So that's a great perspective to understand. And we got to change that narrative. Now, what people are seeing in these highlight reels, and not just at the hospitals, like this, they don't ever highlight the airway distress. I think the biggest airway distress we see is that they don't even recognize is what? The snoring, right? They think it's cute. What other things are you seeing?
Correct. So the signs and symptoms of this airway obstruction known as BOAS start with snoring, okay? That snoring happens because they're at rest and they have no control over that flap that's sitting in their throat, right? And it's going into their throat. And that's responsible for some of the snoring. Of course, these dogs are not like other dogs. So if you compare a short-nosed dog to a long-nosed dog, there's something important that they lack. It's called frontal sinuses. They have none, right? So there's already too much stuff in too small of a space. Now, we can't go ahead and reform their skulls, but we can remove tissue that's blocking the airways, and that's soft tissue. And this is a big problem for these dogs, and it is a problem that we have a solution for, that we can remove those parts in their throat. Now, other than snoring, we see open mouth breathing. Why? Because they can't breathe through their nose, so they got to open mouth breathe. Another obvious and common symptom is that they can't exercise and they can't tolerate the heat. So exercise intolerance, heat intolerance. Why? Because When you can't breathe through your upper airway, you can't ventilate, you can't release your body heat. And that's how these dogs have to release their heat. And they
Yeah.
can't do that through their upper airways. They're going to get too hot too quick. You are here in Las Vegas with me. They can't last outside for 5-10 minutes in this heat. Okay. That's a problem. They're going to start to collapse. They're going to start to get too hot. And the body can't deal with temperatures over 103 degrees for very long. Okay. So that's like a microwave oven, a recipe for disaster. Okay. The other common signs are hacking, right? Because they're trying to get that flap out of their airways, right? Regurgitation, because that flap is filling up with food or saliva, or they get excited, it swells up with food and saliva. Regurgitation, they have a pressure system building up. It's called negative airway pressure. Let me make it as simple as I can. You ever have a handheld vacuum?
Yes.
Imagine trying to just attach that to the dog's mouth. What's happening when they're breathing? It's like a tug, and it's like a pull and a tug system that is going through their airways and their stomach, right? So what's happening is it's irritating their esophagus. It's creating inflammation there, esophagitis. It is irritating their stomachs. They get gastroesophageal reflux disease, GERD. They even have so much pressure that that esophagus is starting to get pulled, and they get what's called hiatal hernias. We can see a lot of these problems just by taking routine x-rays. And that's a big part of us in general practice. Well, we have to analyze what the problem is. And so snoring, hacking, open mouth breathing, chronic fatigue from not getting oxygen, we end up seeing these dogs having liver problems because the liver also, believe it or not, relies on oxygen. Heart stress, blood pressure issues. Just in general, when you can't get oxygen, your body does not deal well with it. So your parts need oxygen, and this is a big problem in many factors. And as they get older, they also get higher risk for laryngeal collapse. Starts at stage 1, then goes to stage 3. Once that starts happening, there's no great fix for that problem.
Yeah. I mean, you touched on a lot. And that's what the influencers refuse to really acknowledge. And a lot of this may be just benign ignorance, but you got to know what you're getting into. I would never purchase a Ferrari without understanding the financial and maintenance cost for said vehicle. And not to compare apples to oranges, but that's just a relatable conversation I believe we need to start with so they at least get some appreciation, understanding. In veterinary medicine, obviously, we're always negotiating for someone or a pet's quality of life because they can't speak for themselves. And it's hard to really resonate with the pet parent who doesn't feel that stress or those levels that you just mentioned. If that was any of us, we would be in the hospital. Say, I don't care what the cost is. The stress of me not being able to breathe, the anxiety of me strangulating is enough for me to charge it to the card, care credit. I don't care what you got to do. I need to remove that issue from my circumstance for quality of life in general. And it just leads me to my next question, Doc. Do you feel veterinarians, do you think we underestimated this entire, the power behind the influence to promote this breed? I feel like we weren't ready. What are your thoughts?
I think to a large degree, we have failed to be influential enough as far as social media goes.
Yeah.
Because as veterinarians, we know if we practice good medicine, the pet parents are gonna, who come to us are gonna understand that, right? And they're gonna be that long-term relationship for us. But we have a responsibility not just to educate those people in our neighborhood, but we got social media now. So if you're doing something, show your value and talk to the world about it so that more people can get the help they need. And if their vet can't help them, we were talking about this, then ask for a referral to someone who can handle it. Yeah. But we have that responsibility to address that, whatever that popular breed is, in the right way. And there's always going to be those influencers out there that are promoting these breeds. Yeah. But we have to be able to promote animal health and any animal welfare issue. If it's not going to be us, then who's it going to be? It's not going to be anyone else with any credibility.
That's right. I mean, I'm not your tax auditor. I'm the veterinarian, and I do this for a living. Dr. Mann does this for a living, right? So I think the acknowledgement and the understanding that I'm coming to a professional for professional advice. We're not here to hurt you as a pet parent. We're here to advocate for your pet who can't talk, and we just happen to know because this is our lifestyle, right? I think that's important. I do want to kind of rotate on the normalized dysfunctions, right, that you mentioned. And there are a lot of them. So bear with us. Let's define like the problem clinically, right? Which you did a lot of. And like how early are you seeing these signs show up?
So with these dogs, unfortunately, well, they're called brachycephalic because they have short nose. But what we have a problem now is called extreme brachycephaly, which means that short nose has gotten shorter and shorter and shorter. So if you've seen that French bulldog when they first came out, they've been bred to the fact where their faces are so short and so flat that we're seeing puppies not being able to make it, right? We're seeing puppies that really we want to wait till they're 6 months old because that's when the skull develops, but it's hard because they're suffocating, right? So the question I believe was at what again at what age was it?
Yeah, like where are you seeing these clinical signs the most, right?
So
exacerbated.
Yeah, so with the dogs that are most affected, the shorter the nose, we see those symptoms earlier and earlier. You know, as we see them as they get older, they get worse. And there used to be a wait and see kind of thing. Let's wait and see if your dog really needs to have a better ability to breathe. Yeah. That should never be a conversation. If you do an exam and you see your dog's got a pinched nose with virtually no nostrils, right? Have you ever tried to breathe like this, like seriously for 5 minutes? Do that with a pet parent who's got one of these dogs, right? And say, why don't you go ahead and try to breathe like this for 10 minutes, okay? And then you tell me if you think it's going to be a problem for you or if you want to have that fixed.
Right.
So it's a very obvious problem, right? There's slits in there. There's nothing going on in there.
Right.
And so they got these pieces inside each nostril, those alar folds. We can get those out nicely now with our laser from Vet Scalpel. Made in America. We also are able to remove that flap in the throat in the same way, a carbon dioxide laser that allows us to remove it, not having to suture it.
Yeah.
And so that's a real important thing is we see these problems early. We need to recognize them early because that's the best chance of making a real impact in that quality of life. It's like if you're a person, you go to your doctor, right? And you have a blood test and something's early, like your A1C's up, you're not going to like just gain a bunch of weight and see if you get the diabetes before you make a lifestyle change, right? You're going to recognize that problem.
Some do.
Unfortunately.
Some do.
Unfortunately,
but
some
they
do.
have that choice.
Right. But we have to be ambassadors, right? And so, like you said, with those dogs, early on is when we have to be the ambassadors. We've talked a little bit about insurance and things like that for pets. Most of them are underinsured. Now these insurance companies, they can offer those breeders insurance policies the day those puppies are born. So we got to do a better job in getting more of these higher risk breeds insured because when that problem comes along, they don't have to worry and stress about how they can take care of their family and their pets.
Correct. I mean, you just got to know what you're dealing with. I wish that like a breeder would honestly, in order to do that, you'd have to guarantee the insurance and then pass over that insurance with the sale of said breed. Almost like we have to have proof of insurance before you walk off the lot with that car, right? Because you just know what's coming down the pipeline. And it's not a good conversation for me, for you, for the families, for the finance situation. And then a lot of those guys, in my opinion, my experience, they can't even afford vaccines because they spent $15,000 financing the pet, and you can't protect it from something as simple as parvo, right? So I think those conversations just got to be had held more often. And I want to get into the next part, which is like, why do we allow these behaviors to go on for so long in our community, right? I know we're only one person, right, a piece, but like, what do you think really can help assist in those conversations?
To continue, he's suffering now, but he's going to continue to worsen.
Yeah.
And you're going to have no choice when he's at the ER to have a tube put in him, right? And to have him sedated, to have, multiple days of hospitalization, to potentially not be able to make it because he got aspiration pneumonia. He got that infection going from his upper airways to his lower airways. He got too hot. He got too excited. And we spoke a little bit about being fear-free. Some of the reasons that these pet parents are ignoring it is because they're afraid. They're afraid of what might happen to their pet, whether it is they're getting too anxious coming to the vet. But if we're fear-free and we handle that pet in the right way, that's going to change the visit. That's going to change their experience. They're going to say, okay, you know how to handle medical problems, but you also know emotionally, if my dog's anxious and he's starting to get more swollen in his throat and his nose, it's going to be a recipe for disaster. But if you know how to handle both the medical and the emotional, you can see when a dog gets nervous, those dogs' eyes get wide, right? That face gets tight, okay?
Fight or flight.
These are all fight or flight things. These are all animal welfare issues that we have to recognize and prioritize. When that pet's in there, he's anxious. We got to make sure they've either given him something before the vet visit, if that's the tendency, especially at these high-risk dogs that have airway issues, or we have medications ready on hand to help calm them down.
Yeah.
These situations are manageable, but if we don't recognize them early and we don't give that solution to the pet parent, they're going to continue to be afraid to come back to the vet. They're going to continue to be afraid to have that dog have surgery. But these are all things that we are trained to handle. So if we handle in the right way, both from an emotional well-being and a medical wellness well-being, then we have it under control, because those two things go hand in hand, especially with these crises. We talk about fear, anxiety, and stress. It happens for the pet, fearful, happens for the pet parent. They're afraid to go into the vet. And it happens to the vet who doesn't want to be disrupted, because he's got 15 appointments, 20 appointments to see. And now we got a dog who has a respiratory issue and we don't know exactly how to handle it. And we just want to go ahead and get them out to the ER.
Right.
So we got to do a better job all around with that fear, anxiety, and stress.
That is an excellent point. I mean, to think about it, these guys do come in fearful, afraid on all aspects. The veterinarians are tired, have a long day, and now I know this one's coming in for routine vaccines, and it's about to be a situation in a crisis. And even on the pet transport, which increases all the costs on everybody, and we were just here for said vaccines. The behavior that I'm seeing is, my dog can't get any more vaccines. Last time we went, it was a horrible decision. It was a horrible conversation. I'm not doing it again, so he just don't need it. Just because the problem exists doesn't mean we don't solve the problem and then you move on with your life with bare essentials, right? If your car has a flat tire, you don't be like, oh, well, I'm just done with the car. We got to put a new tire on it and then keep it moving. And I believe, not to compare that, but it's just, that's how simple we have to make it seem. And as you understand the cost that comes or associated with this type of procedure on the BOAS side, you got to accept that with the purchase of the breed. That's what comes with it. You said 17 times and 12 times Frenchie and Bulldog respectively?
Correct.
That's a guarantee. I mean, that's a guarantee. So we got to do better understanding, like, hey, if I commit to this breed, what else? And if you didn't understand in this layman terms, you got to do more research and really just consult with the vet to say, I want this, but what do you think? Not the breeder, not the influencer, us, right? Because we're going to give you all those challenges up front. And if it needs to be person to person before you purchase that pet, then so be it. Because at the end of the day, it doesn't do us any good to say, we told you so.
Right.
Doesn't feel good for anybody. And that pet suffers. And the owner, that human animal bond gets beat up, and then we have to be the villain. Because no one wants to be the villain in their story, right? So that's what I'm seeing often. I want to talk about the veterinary communication real quick too. And this is where you and I separate ourselves from a lot of these, introverted vets that really just don't want trauma, don't want any conflict, don't want any like, hey, I just don't want to be liable, leave a good review, and he looks good. I feel like that does our industry a disservice. We have that obligation that you mentioned, and we took that oath a long time ago, whenever you graduated. And I believe sometime in translation, it just got lost. How do you feel we approach that situation to our colleagues to say, look, you got to continue to advocate for them, right? How do you manage those expectations from vet to vet?
So not every veterinarian is going to have the same level of training for certain conditions. I may have a passion about, helping these dogs breathe. And this other veterinarian may have a passion for, doing a gastropexy surgery, right? And if I know that veterinarian is not capable or doesn't have the training or the experience to do something, I don't expect them to all of a sudden do it. Mm-hmm. But if they recognize a problem that's an animal welfare issue, they need to recognize that that's something that requires a referral to someone who has some experience to handle that problem. We have an oath, like you said, to recognize any pet that suffers. And when we spoke a little bit about, not doing it early enough or sweeping it under the rug, what some pet parents don't understand is that French Bulldog or that Pug or that English Bulldog, it's eventually going to need anesthesia. Why? Because it's going to have its teeth cleaned. Why? Maybe he has a lump that pops up, right? He's got a reason he, broke a ligament in his knee, right? He's got now to have anesthesia. This procedure is one procedure that is going to make it safer for that dog to have any anesthetic event. Doesn't matter what it's coming in for, because if it can't breathe going into surgery and coming out of surgery, then your risk level is high. Not only because that dog needs to have anesthesia, but then it has to be managed for that airway problem when it wakes up, because it's going to be anxious and nervous, and it's going to wake up with a swollen throat and a swollen airway. And then what you're going to do about it. So this is something that is going to transform that pet's life and make it safer for that pet for the rest of its life. So when we compare this to people, right, and we mentioned one thing, we didn't really get into about the sleep. How many people hate it when they can't get a good night's sleep? How many people go to sleep clinics? If you look at, the human side, it's highly specialized. You get placed in whatever these hospitals are or these clinics where they're sleep apnea clinics. They monitor you. They put you on different machines. And so these dogs suffer in the same way. A lot of these dogs, and the pet parents will come to me, my dog will not sleep without that toy in its mouth. They have learned that toy in its mouth will keep that mouth open and keep that airway open. And they are not dumb. Yeah. They know they need to breathe at night, and they'll wake up at night and they'll have to reposition. So we've come a long way to recognize all these problems, and we're doing a better job at advocating for them. But we're still way behind where we need to be as far as the conversation, the early recognition, and the referral if we can't handle it.
Right. Do you personally go or just solicit to your local areas? Or, the state of Florida, that's, in my opinion, for you being very niche and like one of one to do this type of situation in your area. And I'm not too familiar, but you're the GOAT when it comes to that. Do you go clinic to clinic, and like, does your area know you, like, hey, Frenchie's specialist, you got to go. You got to see Dr. Man. Like, how do you solicit that? Do you just make sure everyone's comfortable? And I know for us, wait times are always the biggest issue for an issue that need to be resolved yesterday, right? So even my specialty recommendations come with like a month out, sometimes longer.
Right.
So that doesn't give anybody any credibility. And you deal with the issue today with the pet parent. Over time, they feel like he's fine. And then we forget it and it gets lost under the bridge, right? How do you manage those expectations in your area?
So and you and I spoke about this before, is seeing something is believing something, right? Okay. And this is one of those problems that you can see that dog coming in.
Normal.
Yeah, not normal, right? Having a hard time just in the air condition, in our lobby, right? And you can see a dog go from that to not having to open its mouth to breathe, and to loving life, playing outside, chasing a ball, doing things that the pet parent never thought it could do because that had to be an inside dog. That is something you can recognize as a human being. I don't care who you are, whether you like dogs or not. That dog was suffering, and now that dog is not suffering.
Right.
So when you say, do I, solicit to other hospitals? I think our responsibility is, and for every veterinarian, you have a passion about something, you put that passion out there and you show what you're doing to help that pet. That's our job, to educate everybody. So when we do these procedures, I put these stories on. I document every one of my cases, and I put them on there time and time again, because there are so many people nervous about things like this. Yeah. They need to understand they don't have to be that nervous. Yeah. There is a way to handle it in a better way. We've come a long way. We have found solutions that before maybe weren't as readily available or weren't handled in the right way. There's a number of different ways to handle these dogs in a safe way, so they are having good recoveries, and most of them are outpatient procedures. They come in the morning for that procedure. They go home that same day. They don't have to be hospitalized. They don't have to sit in the ER in the oxygen cage. Yeah. So it's a better way to manage a lot of things. Of course, communication starts on day one. When that puppy visit comes into you, you got to make sure you have spoken to them about the possibilities and making sure that you prep them.
How often, I'm glad you mentioned that, like, how often are you seeing the first time clients come and like, I don't think you fully got it. And then the second time they come, like, how often are you seeing, like, I got to nail it this time? Because, even if you tell me that doesn't mean I'm necessarily receptive to said information as the client, right? Because I was here just for vaccines and sometimes a free office puppy exam, right? And the value doesn't come with, man, here's another bill down the pipeline, because that's usually what they hear. How often do you see, like, I need to repeat this, or I need to come in, please come in and see me again? or the whole staff needs to be on board to say, hey, it's important, it's important, it's important.
So with any animal issue that is affecting their quality of life, I mean, that's our priority number one. Our priority number one is not nail trims and it's not vaccine. They can go to a vaccine clinic for that. It's that pet who suffers. And if that pet suffers as a veterinarian and you don't document that, then that's really, on you, because your job is to do a physical exam, see what's normal and what's not normal, and then talk about what that means for that pet and how that's going to affect that pet for the rest of its life. Is it going to decrease their lifespan? Is it going to put them at risk for a collapse? We have to have those conversations because that's our responsibility. And those conversations have to start early on. And so if you've educated the pet parent and you haven't been able to, get them to that point, you have to continue that education. And sometimes it's just a matter of keeping things simple.
Yeah, I love that. I mean, we talk about a lot of these surgeries and clients really just hear one language, which is how much it's going to cost me, right? What would you say that range usually rounds? And I know every state's different. I mean, every service is different. So I don't want to do gold standard, but just like a range for pet parents to understand this breed comes with this type of cost potentially. And you're very, less invasive. Sounds like not a lot, minimally invasive, no extenuating blood that can affect the surgery or compromise issues. I know as a veterinarian, if I'm doing this, I would want to keep them overnight to protect the return on my investment, because anything can happen when it comes to going home with the pet parent who's not always as compliant and concerned. So I know I'd want to see them, but because you've been doing it this way for so long, you're like, yeah, that's not necessary. But a lot of people aren't doing it your way, right?
Mm-hmm.
Which is amazing. I'm glad you're doing that. So, like, what do you feel that cost range would be for pet parents to say, understand this is a baseline?
Sure. So number one, just to kind of get into some of the specifics, if a patient, if a pet, doesn't matter the breed, comes into our hospital and we are involved in that care, at the end of the day, if something happens with that pet, as a veterinarian, that's your responsibility, right? So I would never get involved with a pet parent if I had a communication with them where I said to them, listen, this is a procedure that can have some problems. And if those problems are recognized and we see any concerns, we are not going to wait and see and go to the ER, or wait till the next day. If there is any concern that there is a failure in recovery from anesthesia, regardless if it's dental, regardless if it's, for a lump, anything can happen after anesthesia. If there is any discrepancy, we will always refer them to overnight to have that managed care. As far as cost goes, if we're looking at these types of procedures at an ER or in a hospital that has 24-hour care, I would say ballpark, and I'm in South Florida, is anywhere between $5,000 to $10,000, ballpark. But I find that our cost can be lower because we often do not need that ER care. So I would say around 5 or under. And why I say that is because I get involved with every dog in this kind of like you did that analogy with a car. You got to know what you're getting into.
Mm-hmm.
So I'm going to do a full evaluation of that dog's health. And what that full evaluation is going to be is electrocardiogram, because a lot of these dogs have low heart rates and they need atropine. Okay. We're going to do blood work to make sure that any of the drugs we give them is going to be okay with their system. They don't have kidney issues. They don't have liver issues. And we're going to get images of the throat, the upper airways, and the lower airways. We're going to check those heart and lungs, those vital organs, and all those parts inside the belly to make sure that we know if there is another congenital problem, how are we going to manage that during anesthesia, before anesthesia, after anesthesia? We need to do a full evaluation regardless of the age of the dog, because these are special situations that require, recognition. And
Right.
when you have a dog that has anatomy that's different to other dogs, as long as you're doing your full physical exam, you're doing the workups, you know what those patients' problems are, you're going to have a much better outcome by doing those things. And I'm not like every veterinarian. You're not like every veterinarian. We do our full workups for a reason, because as veterinarians, as good as we are, we can't talk to them and say, hey, do you have, a problem with your lung lobe? I'll take x-rays on lots of these dogs and I'll find, okay, that dog has aspiration pneumonia, needs to be on antibiotics before it goes into the anesthesia. Pet parent didn't know. He just thought that it breathes funny and that's normal, right? So he has to have antibiotic before anesthesia, has to have x-rays taken again, right? He's got a trachea that's way too small. We got to be careful with that. He's got something that doesn't look normal in his larynx. Could be a polyp, could be something else. There's other things that we find on these tests that do not require anesthesia that are so important for practical purposes. And as working in a general practice is our job to manage all those issues and to find those issues. So if there are things that I would say are hard to manage, we need to make sure we recognize that before the anesthesia.
I love that. Well said. Well said. Because that's, we're not a magician. I think that's the biggest misconception a lot of pet parents have. You love animals, you did the work, you got the doctorate, and now you should just know my dog.
Yeah.
Right? I get them like for a 30-minute window out of 365 days, maybe in a year. And it comes with a lot of trauma that you don't know, and I definitely don't know. And you know your pet more than anyone in this room. So let me verify. Trust, but verify. Because at the end of the day, what if I'm right? I hear what you're saying. He looks fine. He's good. But what if I'm right? And that's not fair to the pet that can't talk, which is excruciating for everybody because you don't know what you don't know what you don't know. So I just, I love how you put that in perspective, Doc. If this intervention doesn't happen for these pet parents on such a massive scale, for the number one dog in the country, where does this lead to? Where does this go, Doc? Where are we going with this?
This is only going downhill. Time is our enemy. Time is crucial. Any disease, any problem, when you recognize it early, we know that problem has a much better chance of being resolved or improved, right?
Yeah.
So you don't want to just wait and see on these problems. There is no benefit to that. And, for any procedure, I would just say make sure that the vet you're working with is comfortable with, working on that breed of dog or that type of problem. Have the workups done because, those are important things for veterinarians to understand and for you to understand what may be involved with yours. Every pet's going to be a little bit different. And we can't predict, as you said, what we're going to find. But definitely not doing anything about it is the wrong choice because at the end of the day, as a pet parent, our responsibility is to give them the best life possible. And if they're going to go from having good days to having bad days and then have more bad days than good days during the week, then that's a problem. That's like when we talk about those senior pets, about, their quality of life and not being able to live with that poor quality of life. That's kind of like what we're talking about. But these are young dogs because they start to go downhill at a young age. And you can't just accept that as a human being. That's just not acceptable.
Yeah, I love that. Very well said, Doc.